And welcome to the Dr. Bob Show. What do you think about the term heart murmur? What if your doctor told you you had a heart murmur? What would it make you think of? Would you know it was something serious, or could it be innocent? Could it be something that's not dangerous? Or could it be life-threatening? Could it be something that later on down the road may need you to prepare your last will and testament? We'll be spending most of this show talking about heart murmurs. There are murmurs that come from different valves in different parts of the heart. My guest is Dr. Malcolm Foster. Dr. Foster is a board-certified cardiologist, and he'll be answering our questions. Hello, I'm Dr. Robert Overholt, and I'll be your host for the next 30 minutes on the Dr. Bob Show. Later on, we'll be talking about bronchial asthma, and we'll be talking about heel pain, the difference between bone spurs and plantar fasciitis. A lot of information for you. You'll want to stay tuned. We're talking with Dr. Malcolm Foster, board-certified cardiologist, and we're going to be talking about heart murmurs. How serious are they? Malcolm, welcome to the Dr. Bob Show.
Thanks, Dr. Bob.
When you hear a murmur, what does that mean? What is a heart murmur?
Normally we hear the first and second heart sounds, lub-dub, lub-dub. A murmur is extra noise as the blood flow goes through the heart.
Is that between the lub and the dub, or after the dub, or?
It can be either.
So it can be anywhere in there. But you're able to tell lub-dub, if it's while the heart's beating the blood out or while it's resting.
That's right. So a systolic murmur is as the heart beats, and a diastolic murmur as the left ventricle relaxes.
So are all murmurs serious?
Not necessarily. Some are what we call innocent murmurs or functional murmurs.
What's innocent or functional? What does that mean?
Under certain circumstances, there can be more blood flow going through the heart. And a common example would be a woman during pregnancy, and there's extra blood volume, and that can be an innocent murmur that goes away when she delivers.
So while the lady is pregnant, you can sometimes feel or listen to the blood come through the heart, and it's called a murmur.
Yes.
Systolic, functional.
Yes.
Another example.
Well, in children, oftentimes in children, and it's very worrisome to parents, but oftentimes murmurs in children are functional murmurs. Children are growing, their hemodynamics change over time, and later in adulthood, there's no more murmur.
So if you hear a murmur in childhood, is it more frequent that it's going to be innocent, or you have to go through the different type of murmurs in your mind to decide if it's functional? How do you know?
Well, we start with the stethoscope. So for example, a pediatrician, someone that's used to listening to children and their hearts, they may be able to determine that it's likely a functional or innocent murmur. If it's more serious, then we would go on to do testing, an ultrasound called an echocardiogram.
Okay, so if the doctor thinks it's serious or is not sure, then you've got other tests that will help you determine that.
Yes.
How about an overactive thyroid? How about anemia? What type of murmurs do those produce?
Yes, those are also, again, innocent murmurs or flow type murmurs. So if a person is anemic, their blood count is low, and that blood flow is going more rapidly or turbulent through the heart, it can make noise.
Let's talk about heart valves. How many heart valves are they?
4 heart valves.
Let's go through. One of them's aorta, one's mitral, one's pulmonic, and then there's
tricuspid.
Tricuspid.
Yes.
So of those murmurs, let's talk about the mitral valve.
Sure.
I hear more about mitral and aortic than the other valves. Is a mitral valve murmur serious?
Well, it can be serious, certainly. That's when the heart beats, the left ventricle beats. The blood flow is supposed to go out the aortic valve, but a mitral murmur typically is when the blood flow, it goes backwards to the left atrium and toward the lungs.
So that's mitral regurgitation
Yes.
or insufficiency.
Correct.
What's it sound like?
Well, it's a soft murmur because it's going into a low resistance area, which is the left atrium and the lungs.
So when you say it's a low volume, is it, or is it,
More of the,
and does it go through the entire lub dub, or is it at the end of the lub dub?
so it's during systole between the first and second heart sounds, and it tends to pour out of the first heart sound. So it's early in systole, unless there's a mitral valve prolapse, in which case it might be later in systole.
So there are different types of mitral murmurs. Are they different in their seriousness? If one is complete between the two sounds, mitral insufficiency, what are the potential dangers of that?
Yeah, so one that goes throughout systole can be serious. Sometimes we call it wide open MR, wide open mitral regurgitation, and that would be the serious example.
How do you decide if it's serious?
Well, again, we start with the examination. So we listen with the stethoscope, but then we really rely on the echocardiogram to help us with that.
So you've really got a lot of tests now that help with the old. Is the stethoscope, will it ever become out of date?
I don't think so. However, you can do an echocardiogram from your pocket with about the size of a smartphone, and that's probably going to overtake the stethoscope for many physicians.
So you could do it at the bedside. It wouldn't be quite as good as the other one, or almost as good?
So a bedside echo is very, very good. Not quite as good as when the technologist comes in.
Tell me about the mitral valve prolapse, or tell me about that.
That is when the mitral valve is supposed to close flat, but prolapse is when it tents, like that. And when it tents, it can then leak. Okay, so it's tenting and then leaking. And that's why there's typically a click and then a murmur, and that's a systolic murmur later in systole.
Is it more dangerous or less dangerous than mitral insufficiency?
It actually tends to be less dangerous. We follow lots of people many people with mitral valve prolapse for many years, and oftentimes people are stable and they don't have to have anything done about the valve. But later it can become more serious with leakage or regurgitation of the blood flow.
If you repair the mitral valve, how do you do that?
Well, it is a surgical repair mostly. By a skilled surgeon, and that is an example of open heart surgery. Sometimes it can be done minimally invasively, which is great. And then in certain cases, there's a procedure, there's now a clip that can be applied to the mitral valve leaflet. It's called a mitra clip, and that's a catheter procedure for a portion of those mitral valve patients.
How do you decide when the patient's going to need the valve to be replaced or to have the surgery, or that's going to really be a big decision, a big change? How do you make that decision?
It's a great question. We don't want to operate too early. We also don't want to operate too late. So we tend to follow those patients fairly closely. For example, an echo every 6 months or so to determine the optimal timing of surgery.
So with an echo, it's going to tell you how much blood is going backwards, or how fast it's going, or how much noise it's making. What are you looking for?
Right. And also the impact on the heart. The heart can become dilated. So and the patient may not appreciate that. That's not something they know about. But if you follow serial echoes, the heart can become dilated, the pumping function, the ejection fraction can become reduced. Those are all serious findings that tell us the person may need surgery.
Symptoms of mitral insufficiency or mitral valve prolapse?
Yes, sir. Shortness of breath is probably the most common symptoms. Shortness of breath. More severe would be congestion, where it's almost a drowning sensation. They can't lie down. They have to be propped up on pillows.
Surgery successful, mitral valve surgery?
It's very successful. The only thing is we don't want to wait too long. We don't want to wait too late. Then it's more complicated.
Aortic valve, does it cause problems?
It certainly does.
And that's what we're going to be talking about. Mitral valve can cause a lot of problems. Aortic valve, maybe more problems. We'll have to see. You want to stay tuned. We're talking with Dr. Malcolm Foster, board-certified cardiologist. We're talking about heart murmurs. Some are innocent or functional. They're usually an overactive heart, young people, pregnant women, people exercising where we can hear the blood flow, but it's not of a serious nature. Then we went into the mitral valve, mitral insufficiency, where the blood, instead of going out where it's supposed to, goes back from whence it came through the mitral valve prolapse, mitral insufficiency. Now we're going to be talking about the aortic valve. Where is the aortic valve and what's its purpose?
The aortic valve separates the blood flow from the left ventricle, the pumping chamber, to the aorta. And when the heart pumps the blood, when the left ventricle pumps the blood, the aortic valve is supposed to open up fully, let the blood out, and then close fully to avoid regurgitation or flow back to the heart.
So this is the valve where the heart is pumping the blood to the rest of the body.
Yes.
Pretty important.
Yes.
Is it pretty important more when it closes or when it opens?
Well, both. I would say the most common problem we see is when the valve gets more narrowed over time. So that's called aortic stenosis.
What makes it narrow?
We don't really know, but it degenerates and it becomes thickened and it becomes less pliable. So instead of opening fully, it only opens.
It wants to open, but
Yes,
can't.
right.
Calcium gets calcified,
Yes.
gritty, feels bad.
Sure does.
When you've got aortic stenosis, then what's that murmur sound like? The high-pitched mitral valve was sort of a little swoosh. What's the aortic stenosis sound like?
So it's a harsh murmur. It's a.
Does it radiate up into the neck?
It does. It goes toward the neck and the carotid arteries.
So is it easier to hear?
It is. You can oftentimes hear it with your ear if you apply your ear to the chest, like the person's spouse.
So if you've got an ear on the chest, on somebody else's chest, you might hear a heart murmur that time.
You don't even need the stethoscope.
And does it sometimes, can you feel the vibration of aortic stenosis?
At times you can in the proper area when you feel with your hand.
And the aortic stenosis, if the blood is having a hard time getting out, you have to follow that. How frequent?
Well, we follow it fairly frequently when we're thinking about surgery. So we typically every 6 months or so. And the heart can become thickened. The heart's pumping against that narrowed valve or that stenotic valve, and the heart muscle can become thickened, and patients can have complications.
They get chest pain, chest discomfort. Can they get angina because of that aortic valve?
They do. They get angina, and then later they can suffer congestive heart failure symptoms, and they can even collapse. They can faint or collapse.
So congestive heart failure symptoms because of aortic stenosis. That just means the heart's not working, and what happens?
Well, that's actually fairly severe, and if the aortic valve is not replaced, a person can die from aortic stenosis.
It's a lot different replacing the aortic valve now than it used to be. How did they replace the aortic valve?
Traditionally, it required open heart surgery, so that was a sternotomy in the middle, open the chest, replace the valve. Surgery is still excellent. It can be done with more minimally invasive techniques. And then there are catheter procedures called TAVR or TAVI, where it's a valve inside the valve to open it up.
So you can go, how do you put in a TAVR, TAVR, total aortic valve replacement?
Right, and so it's usually from catheters that are placed in the femoral arteries in the legs.
It just seems like that'd be hard to do. Is it hard or is it easy? You've actually bought one of those here to the Dr.
Yes.
Bob Show and showed us one time.
Yeah.
How difficult is it?
Well, it's actually fairly straightforward. Technically, it's fairly straightforward, and we have very good success rates. We've applied it to the older and sicker patients early on, and they've done really well. And so now we're looking at the more mainstream patients with aortic stenosis.
How do you decide when the person is ready for that aortic valve replacement? That's a scary decision, just like the mitral valve. So how do you decide? Through echocardiogram? Or?
We follow the echoes, but importantly, we have to take a good history. We have to ask, are you exerting yourself? Are you having any symptoms? Sometimes there are no symptoms, but it's because they stay on the couch. They don't exert themselves.
It would be truthful too, wouldn't it? So you've got stenosis, where that's when the heart's beating, has a hard time getting the blood out. What's aortic insufficiency?
So rather than a sticky valve, that's a leaky valve. Oftentimes that may be a bicuspid valve. Instead of the 3 leaflets, it only has 2, and they're more susceptible to leakage, where it opens adequately, but it leaks as the blood flow comes back.
If you've got bicuspid,
Yes.
that's usually congenital.
Usually born that way, yes.
If somebody has aortic stenosis, do they frequently have at the same time? It's hard to get the blood out, but once you get it out, it comes right back at you.
They can have both, and we call that a mixed lesion.
More dangerous?
Well, it gets a little complicated trying to decide when is the right time for surgery to replace the valve.
So if you've got a mixed aortic stenosis and aortic insufficiency, what's it sound like?
Well, it has 2 murmurs. It sounds like
So the is the blood is coming out, and is when
Yes.
it's relaxing.
Yes.
Easy to hear?
It's fairly easy to hear with the stethoscope. The systolic murmur, the diastolic murmur, that second component, that's more difficult to hear.
The other valves, the pulmonic valve and the tricuspid valves,
Yes.
do they have significant murmurs frequently also, or is it predominantly mitral and aortic?
Mostly mitral and aortic. Very unusual for the pulmonic valve, except in children. And then the tricuspid valve can have a murmur, and we can get a little bit confused between tricuspid and mitral because they sound similar. Most of the time, tricuspid valve does not require surgery.
Now, I want to spend a little bit of time about talking about murmurs in the heart that don't come from the valves. If they don't come from the valves, where that's the blood flow, where else would they come from?
So most commonly, a hole in the heart.
So you can have a hole in the heart. Is that frequent or infrequent?
It's infrequent. Usually a person is born with that, most commonly. And as the heart pumps the blood, going out the heart valve, it can also go across the hole in the heart and again give a sound, a heart murmur that's not related to a heart valve, but through that hole in the heart.
So one of those would be, what would you call that one?
So a ventricular septal defect, or a VSD, would be an example.
Easy to hear? Is it systolic? Is it diastolic?
It is a systolic murmur, and it is fairly easy to hear. And then when we look with echo, it actually can be a little tricky to spot with echo, but then when you see it, then you know it.
So with systole, you've got systolic murmurs, you've got mitral insufficiency,
Yes.
you've got aortic stenosis, and now, so where is the VSD located?
Well, it's in the septum between the left ventricle and the right ventricle.
Whereabouts is
so
it
it's
on the chest?
about right middle in the chest.
Right in the middle. So we've got the other 2 chambers, the atrium. Can you get a hole between those 2?
You can.
Oh my gosh, now we're getting more complicated. What's that called?
That's called an atrial septal defect, or an ASD. That murmur, the flow is hard to hear, but it increases flow through the right side of the heart, so they can have a pulmonic flow murmur.
So we've got VSD, ASD. Now, one other murmur I wanted you to mention, just its characteristics. Patent ductus arteriosus.
Yes.
So what's a PDA?
PDA is the connection between the aorta and the pulmonary artery. It's one of the connections that we all have before we're born, and usually closes up, but in an unusual case, it can stay open.
And what does it sound like in a murmur?
It's a somewhat continuous murmur.
So the murmur that I remember, and I like to remember,
Yeah. Yes.
it just keeps going there back and forth.
Right.
So you've got murmurs that you can, I think it's a mental challenge to figure what it is. Then you've got your echoes and your tests, and then you've got the decision of whether to replace those valves.
Yes, sir.
Malcolm, it gets more and more complicated, and you make it more easy for us to understand. I thank you so much for coming to the Dr. Bob Show and telling us all murmurs don't have to be serious, and we need to follow certain ones to make sure that they don't cause problems.
That's exactly right. Thank you very much.
Isn't that great? If you've got a heart murmur, know that you need to find out what it's due to and what the consequences are for your heart murmur. You most likely, if your doctor thinks it's serious, he'll want you to see a cardiologist, and the test will then show your doctor what's going on and what he needs to do. Great discussion. And now you're going to want to stay tuned. We're going to be talking about the difference between plantar fasciitis and a heel spur. They both cause heel pain, and they can be really, really different. And allergy shots and asthma. There are two different kinds. We'll be talking about those. I want to thank Dr. Malcolm Foster. Wonderful discussion on heart murmurs and what to do about them. Now for questions from you, the viewer, that I think will be important to your health. Question number one. Dr. Bob, what's the difference between bone spurs and plantar fasciitis? We're talking about heel pain. And it can be devastating because there's nothing that hurts worse than heel pain when you wake up in the morning. If you wake up in the morning with heel pain and the first 2 or 3 steps really hurt, it's probably plantar fasciitis, but it could be a little bone spur. So let's talk about the difference between the two. Your heel, at the bottom of the heel, you can get a little bony overgrowth that goes toward the front of the foot. That's a bone spur. That can be inflamed, it can be red. It usually responds to rest, to ibuprofen, to maybe alternating heat and cold, but usually does not require massaging and stretching the foot in order to make it better. The other differential diagnosis is plantar fasciitis on the bottom of the foot, but attaching to the heel is the fascia on the bottom of the foot where the arch is. You wake up in the morning, it hurts to step on the foot. And what helps that is massaging the foot first thing in the morning and wearing special shoes or keeping the foot flexed, and exercises and physical therapy and ibuprofen and heat and cold. So sometimes it's difficult to tell the difference between the two for your doctors, and sometimes x-rays will help tell you. Not everyone with a bone spur has heel pain. They may have the bone spur, but simply the plantar fascia that's inflamed. So your doctor will be able to differentiate the two. Heel pain, unless it's a fracture there, is usually a spur or plantar fasciitis. Sometimes it's very, very difficult to get well quickly, but in a period of 4 to 6 months, you usually can get that taken care of. Rarely does either require surgery. Question number 2, Dr. Bob. Do allergy shots help asthma? That's a good question, because whoever wrote the question didn't say what type allergy shots. There are some new biologics, some injections that help people that have asthma that's driven by certain cells. We call those the eosinophils. So if we've got somebody that's got asthma, there's 2 things with asthma, spasm and inflammation. If the inflammation is the eosinophil, we have shots that we can give once a month or twice a month that take care of the eosinophils and keep them away from the lungs. And when that happens, the inflammation of the asthma seems to go away. Now, the other allergy shots could be somebody that is skin tested that's got allergy. If somebody has an allergic nose, there's an 18% chance that they'll go on and get allergic lungs, asthma that's secondary to allergy. Skin testing can determine whether that's going on in your lungs. The allergy shots that we give there, you have to be very careful with, because if somebody's on allergy shots, it's proven to definitely, unequivocally help asthma. Let's go back to asthma. There are 3 causes. The allergic cause, this allergy shots help that. There's an infectious cause where you get infection. Antibiotics and early treatment will help that. And then there's just lungs that just wheeze. We call that intrinsic. So the allergy doctor can do skin testing and find out if allergy shots would help. If you have asthma and allergy shots, be sure that you do not get your shots when you're having a flare of your asthma, so that you'll be working out with your allergy injections. So we've got biologics to help now, and allergy shots to help allergic asthma. It's all the time that we have for this show. I hope you've enjoyed it as much as I have. Remember, the 4 things that we like to talk about. Number 1 is exercise. Exercise helps almost anything. It helps promote collateral circulation, new blood vessels in the heart. It reduces stress. It lowers your blood pressure. It makes the heart beat slower. It gives you a runner's high where you feel better. And so exercise, and it doesn't have to be no pain, no gain. Probably better that way, but just get your tennis shoes out and go for a walk for 30 minutes and do that 5 days a week, hopefully 7. Eat properly. We know what kind of foods we should eat. Google a Mediterranean diet or a DASH diet. These are fruits and vegetables, low salt, and they'll help you reduce your blood pressure. They'll be better for your heart. They're the long-term help for your heart and increasing the length of your life. Sleep. Remember, 8 hours, 7.5 to 8 hours of sleep is what we need. If we sleep well, we perform well. And most of all, what is it we like in the Dr. Bob Show? It's that laughter in your life. Be sure that you laugh a lot, giggle, and you'll stay healthy.